Very impressive. The pandemic has created separation for families, and that, of course, can be very hard.
Simone Kilgore, a mental health therapist, is here now to talk us through that. Simone, thank you very much for making time
Thank you,
for us.
Simone.
No problem. No problem. Thanks for having me.
So this is one of the challenges I have. I can't see my mom. I mean, we're separated by states, but it's also
Yeah.
difficult not being able to see her. What are you telling people about those who cannot see family members?
Yeah, that's very difficult. And sorry about that for you, Charles, in particular. But the thing is, we have to stay focused on our health and what's best for family members, especially our elderly family members. And so, again, people are kind of getting tired a little bit of FaceTime and Zoom. And I'm a big believer in going back to what we know and what we made, how we made it through all these years. I love to write letters or send specific cards to family members. I love to make cards and then have it specifically sent to them that is for them, a message directly from me to them, just sharing how much I miss them and love them and that we're going to make it through this. But until then, if you don't want to make cards or send letters, the best thing that people can do to stay connected is still through FaceTime and Zoom conferencing and just a good old fashioned phone call, connecting with your mom on a constant basis, saying, hey, let's have us a date on the phone every Thursday at 6 p.m. just to in their mood and then stay connected is the best we can do at this time.
Yeah, that's very good advice. Simone, what about like a family member who is really going to isolate themselves and they're not going anywhere? What can you do or say to them as they try to stay healthy and also stay away from people? Any activities or anything you can suggest?
Any activities that I truly suggest, Carol, would be to, yes, stay safe. And if you feel like staying in the majority of the time is best for you in terms of your health, because everybody's different. Everybody has unique medical needs and very specific situations. Some folks, it's not as healthy to stay in all day for several days in a row. They probably need to do things like engage in walking around the block, doing exercises at home. I get up in the morning and I open up my windows. I'm so excited about fresh air and the weather we've been having lately. Some other things people can do, though, to stay active is definitely do exercising, stretching, going out. And when you do, make sure you have your mask and your gloves and that you separate yourself. Like I was this morning at the grocery store, we still have a lot of rules when we're out in public. So following rules is also very important, too.
Very good advice, and we keep hearing about this second wave. Simone Kilgore, we appreciate you being with us this afternoon because we really have to stick to these rules. It's very important. Now, if you need help in finding mental health resources, you can call 211. You will find a live operator on the other end of the line that can connect you to any local resources that you might need. We're going to take a quick break, and we'll be right back.